Everyone, welcome back to Health Tracks at Home. Today I'm going to continue with the health advocate concept that we have been talking about for the last few weeks, but more specific to a response to COVID-19. So many have expressed concerns regarding social media claims, the news and the media claims that seem to be intent on robbing our peace in this time of uncertainty. And my heart is heavy with these claims, quote unquote, that have no basis. And so it is my desire to help you to replace fear with knowledge, and I hope that I can help. I am not a scientist, but my years of nursing have exposed me to many of the aspects of infection control. I did set up the vaccine program for the entity that I worked for, so I learned more about vaccines than I ever wanted to learn. But it has helped me also regarding being an educator and teaching infection control management to all of the clinicians that I worked with. So I do know about the regulatory side of it. I worked in quality for quite a few years. So I do know what regulations the healthcare systems have to abide by to comply with continuing to operate. So hopefully I will answer some of your questions, and this won't be too dreary this week, to assist you with the ability to decrease your concerns or your fears regarding what is going on around you, and hopefully help you with that question that's out there in the world: who can I trust? Our Lord, as we have said before, has said that He has not given us a spirit of fear, but of power and love and a sound mind. And I want to help both you and me have a sound mind and be able to eat the meat and spit out the bones of the information that's out there in the community. So we'll be addressing some of the following questions, and I'm sure a whole bunch more are going to come up to me in the next week, because I talk to you guys and you tell me what's bothering you, or I get emailed, or I get Facebooked, or whatever. So is the seasonal flu as bad as COVID-19? Can we believe the COVID-19 numbers? We're going to talk a lot about numbers. What about the story claiming that the two people had COVID-19 tests, and then but they left before the tests were done, and then they got called with results? Are deaths being attributed to COVID-19 that are not accurate? Do the restrictions that are placed upon us work? Hand hygiene, disinfecting, facial covering, social distancing, quarantine if you're sick, no commingling, are they effective? Are cloth masks or facial coverings making us sick? That's one I get asked a lot. Is social distancing and commingling of our families necessary, since we're family members? And then one I do want to address, even though I'm not completely qualified, I will give you the information that I have, is: are the vaccines that are being developed safe? I can give you a basis for what the vaccines have been in the past and the ideas of what the new type of vaccines that they're working on. We'll address that. So today I want to talk about numbers, and hopefully, like I said, this isn't too boring and you go, oh, I'm done. But I just want to clarify some things. I've had a lot of questions. Is seasonal flu as bad as COVID-19? So influenza tracking has been done for decades by the CDC and WHO and other entities that are involved with infection control in our communities to make sure we don't have pandemics. So this is nothing new. Their job is to protect our communities, to protect us. So seasonal flu affects approximately 3 to 5 million people worldwide every year. That's a lot of people. And it claims approximately 250 to 650,000 lives in the world annually. Approximately 50 to 60,000 of those lives are in the U.S., and they're related to the respiratory diseases that are caused by the seasonal flu. So in context, that's what it's usually like. But we've had a few bad seasons, as you well know, over the years. And everybody is going back to the 1918 Spanish flu, which was our worst pandemic that we ever had in the world. But also we have to remember that during that time, we did not have sanitation practices. We didn't have hygiene. We didn't have all those things. So, of course, it's just going to spread. We had no idea how to control disease at that time. We didn't even have an idea of how doctors were going to help patients. So it was considered the worst pandemic of all time, and 50 to 100 million lives were lost, and 675,000 of those were in the United States. That was a lot. But in 1889, the Russian flu, in 1957, the Asian flu, and 1968, the Hong Kong flu, and 2009, the H1N1 swine flu, all claimed approximately 1 million lives around the world. So that was quite a bit. That's a lot of people, and they were concerned. But we've been through this before. So I wanted to make sure I listed those again to remind you. And there's also SARS, and there's MERS, and there's AIDS, and there was the flesh-eating bacteria, and there has been disease-resistant bacteria, antibiotic-resistant bacterias, and we've gone through a lot of things already, and we have good things in place that has helped us with those things. So when they talk about they're going by statistical evidence, we have got history as an evidence to support what we're doing now. So can we believe the COVID numbers? Well, the CDC and the WHO and our major universities that lead the vaccine research and infection research and disease tracking, such as Johns Hopkins and Mayo Clinic and Oxford University, and also our own UCSD, have all documented that COVID-19 numbers are correct. They're all in agreement, as well as all of our healthcare systems, Kaiser, Scripps, Sharp, UCSD, who we trust. So they have all stated that these are the numbers. So approximately 17 million around the world have been tested positive with COVID-19, and 670,000 deaths around the world. In the United States, approximately 4.4 million have been tested positive with COVID-19, and we have 150,000 approximately deaths to date. So we are getting up into that million dollar area, the million number that we were so concerned when we've had these other pandemics. And so that's why they're trying to flatten the curve, because we are very early in this virus and we want to make sure it doesn't triple. So are these numbers real? According to the entities that I mentioned before, all of those entities, with a track record of accurate documentation of infections around the world, COVID-19 cases have increased by 1 million in the last 15 days, but with a noted drop in death rate. Is this accurate? That's another thing that I've been asked. Well, how can that be positive? Well, it's logical. So the rise in the cases is attributed to commingling, parties, going to restaurants and bars, and not using precautions. And the decrease in the death rate is due to the age or the population that is now getting the virus, which is the 18 to 39-year-olds. They would just traditionally, they would fight infection better than those over 65. So the 65 and over has gone way, way down, and those that are being tested positive are all the young people. So there's decreased deaths because it's not affecting the population that it could cause potential death. So, and I want to just remind you that, mistakes do happen, and that is part of the basis for the documentation of the numbers. It is kind of built into the system. Human error has always been part of healthcare. We know that that's going to happen, and mistakes are going to happen. Nobody can be perfect. So there will be, it's kind of built into the system. There are very rigid checks and balances in the healthcare systems that requires accountability of reporting and recording positive testing and deaths related to the infection, and making sure you have the right diagnoses and the right death certificates, and that they can be shut down if the wrong information is distributed and they're caught by their regulating people, because they watch them very closely. So if an entity does not follow the protective rules, they can be asked to close their doors. And that is healthcare, and they all know that. So when errors have been identified at each testing center, hospital system, or lab, they have a rigid response system to that error. They already have it set in place what they have to do. And they stop everything. They don't just set it over to the side and go, oh, we'll deal with it later. No, they have to take care of it immediately. So, and then they have a documented time frame for when they can show that they have changed their processes and this type of error will not happen again. So that's when we are thankful that there are checks and balances. Sometimes the regulatory stuff gets a little old, but it does protect the patients, and that's the most important thing. It protects the community. So every infection, every medication error, every documentation error is reported, tracked, and has consequences to correct the error. That is just what healthcare is. So that does extend all the way to the CDC and WHO and to all these major entities that we're hearing information from. They have a responsibility to us to provide accurate information, and if they don't, the powers that be are watching over them and will, bring them to task as far as their accuracy record. They have things they have to live up to. So, what about that story of those two guys that had their 5 minutes of fame and claiming that they went in to get COVID testing done and they got tired of waiting, so they left after signing in, and then they were called with the results of their test, which they never got? Well, again, 5 minutes of fame. We do not know if this is true. There are people out there putting on doctor's coats and saying, I'm a doctor. How do we know they're a doctor? We don't know them. They can stand in front of hospitals. You have the right to congregate. You can get a whole bunch of doctor's coats and you can do that. So we don't really know if those things are accurate. What we can do is research if these things, if a doctor is a real doctor, if a doctor does have something to substantiate what he is saying, and we should follow up on that information. So in this case, there are checks and balances. Again, like I said, at that testing site, they're going to have to correct that error. They already have, I'm sure, and it's much safer than it was before this all came out into the public. But remember that the healthcare systems would not be able to function if these checks and balances were not in place to find errors and protect the public. That is their job. So over the next few weeks, we will talk about some of these other things and more probably about the numbers as well. I hope this helps you understand and have a little bit more faith. Again, I know it's been challenged in our healthcare system, but there are an amazing system of checks and balances. Unfortunately, this is what is holding up vaccines getting done, because the checks and balances protect us to make sure that vaccines are safe, to make sure medications are safe, to make sure that they're effective and that they are not going to cause harm. So those are the things that should happen. It should take time. Expecting in my thing, we shouldn't have a vaccine until the middle of next year. Excuse me. I apologize. Airplanes and coughing and everything. But I just hope that this information has helped to kind of clarify. Watching the news sometimes gets really old and it gets very stressful and it's hard to track. It's just a lot of people, they're telling us this many people died today and we've had 20 outbreaks and we don't know where except they're in a restaurant or whatever. And, so we're not going to get told that information. So don't worry about it and just be safe when you go out and do all the things that you have been instructed to do. And I pray that God bless you and decrease your fear with some of these numbers, to know that this isn't wildly out of the number range from some of our bad seasonal flus, but it could potentially get worse if we do not get a handle on it, because we do not have a vaccine until next year. So I pray that this gives you peace. I pray God blessing on you, and I hope and pray that I didn't bore you with all my numbers. And I hope that I increased your trust in the healthcare system. And like I always tell everyone, call your physician and ask the questions that you might have if you're concerned. They really do want to hear from you. And all of our healthcare systems are making sure that they convey that information. You take care and God bless.